specialists. Really, really come back to everybody here. So kindly bear with me in case there are any offenses, my apologies. So I've picked up a topic that I think is very relevant given the current scenario. I'm sure all of you sitting here have seen a lot of young children and families coming in with complaints pertaining to mental health, secondary to excessive screen time, thanks to the pandemic, which has really unfortunately done it for all of us, including both adults and children especially. So I thought I would start with the case history. So this is something that I think is a we see very regularly, especially after the COVID pandemic, either online or offline. So this is 17-year-old Mr. J, who's in his 12th, was brought by his father with poor academic performance, smoking weed or cannabis, frequently being engaged in brawls and fights, and spending excessive time on the screen, especially with video games and pornography. Very similar to that is Miss S, who is 12 years old, brought by her mother with decreased socialization, being more controlled, taking more drugs, and there's a lot of weight gain as a result. On exploration, it was found that she was absorbed in gaming and Facebook. So this is just like an eye opener, and I will take you through what could be the possible diagnosis and how we tried to help Miss J and Mr. S. So when you talk about what you mean by screen time, I think we've got to start by talking about what is the meaning of cyber. So cyber refers to anything that involves the computer and internet. So we all know that man tends to behave differently when there is a face-to-face interaction as opposed to the interactions which are online, which I think has led to most of the issues. And we know that social connections are fundamental. And like I said, with COVID-19, a lot of it, or more than 90% of everything has been online. Right? For children, especially with regard to their education. So we see that there is a lot of benefit to internet and the virtual world as such, as opposed to a dependency pattern that also arises. In India, we find that online teaching has now become a norm, especially after the pandemic. The Ministry of Human Resource actually even came up with Pragya that provided a roadmap for teachers and parents, especially for the downtrodden society, for those who could not afford to have their own, laptops and computers. And there were different programs for online platforms. So overall, there was an increase in screen time tremendously for children, right from the toddler age group right up to young adults who are college goers. Right? Right. So looking at what we mean by screen dependency disorder. So we understand that the use of screens have become very addictive. So as the name suggests, I think all of us sitting here are also people, we all have cell phones, we all have laptops and iPads. I'm sure all of us keep looking at our mobile phones as such, right? So similarly in young kids, it's really affecting daily functioning, it's really affecting social relationships. So it's very similar to an addiction pattern that you would actually see when it comes to substance abuse, where you have craving, tolerance, withdrawal. So what do you mean by craving? Is an urge to use more and more of the internet or to be more and more dependent on the screen. There's a tolerance. So a child who's usually happy with, say, 20 minutes on social media is no more happy with the same 20 minutes. It has to be much longer. And you'll see why. There's withdrawal in kids who are addicted. So if you remove, the mobile phone, the iPad from them, you see a lot of issues, and I'm sure many of you have heard from parents as such about that. So there's preoccupation with either the gaming or being online all the time. There is persistence. Child continues, to wanting to sit online. They're trying to escape from their problems. There's deception, there's displacement. So all of this gives us an overview that screen use has become quite addictive on the whole, right? So if you look at categories, there are multiple categories. You have internet addiction as such, you have internet gaming disorders, you have problematic internet use, you have compulsive use, there's video game addiction, pathological technology use, there's mobile phone dependence, which I think is again very common, social network sites like Facebook, you have your Twitter, you have your Instagram, so many kids with issues as a result of that. So if you generally look at India, we find that 30% of 8 to 18-year-olds have their own smartphones. And like I said, thanks to the pandemic, younger children have now been given their own cell phones, right? Because parents are forced to give it to them. Children, if there are two children in a house, one is given a laptop, the other child is either forced to, study using a mobile phone or an iPad. So now If you see, there are multiple gadgets in the house, right? Parents are working in different rooms, they have their own gadgets. So the pandemic has made this a necessity. Now, slowly things are changing. However, what is done is that the children have been exposed. So you find that 94.8% of the kids use internet devices. Even in our clinics, if you notice, you have families with children sitting outside a hospital or a clinic is an area where it's really quiet. You don't want the child to disrupt. What do? You give a mobile phone to the child. You say you watch a cartoon, sit quietly, put on your headphones, don't make noise because it's the easiest thing for parents to do, isn't it? You don't have to actively engage with the child. You can just give them a mobile phone, and young children as young as 2 years are completely happy. They're in their own world. And then when you come into the doctor's office, you still find the child bent like this with their mobile phone, isn't it? So then the mother has to pluck and say, "Doctor, look, want to." And then the child is like, "Oh, okay, I don't even know what's transpired here." So this is like the scene that you see everywhere. It's like the easiest thing to do. Like chocolate put the, Emma Hua, it's like the mobile phone or I have to attend this call, keep quiet for 5 minutes. So it's like, it's become like that. Right? So if you look at the survey that was done in Delhi, they found that 60% of the boys and 40% of the girls actually own your own device. My 8-year-old is coming and asking me, my 13-year-old friend has a mobile phone, when are you going to give me one? So my husband said, no mobile phone to use. So then she's like, why? Everybody seems to be having one. So I also want to take photographs. So it's like I said, it's become like the norm to hold on to a device, right? So one to half of them actually use two or more devices to access the internet. You sit on a laptop, you find that the Wi-Fi connectivity is low. What do? You pick up a more first mobile phone and say, streaming is much better here, right? You have the Netflix app on your phone, you have the Netflix app on your iPad on your laptop. So the child knows, okay, so it's as simple as that. So what is some of the neurological correlates? So what happens when a child is dependent on the screen? So they say that there are striking behavioral neurobiological similarities between internet gaming and, like I mentioned, drug and alcohol addiction. So it's as very similar to substance dependence. So by listing this in DSM-5 section, ATA is hoping to encourage research to determine whether this condition should be added to the main manual. Studies suggest that when these individuals are engrossed in gaming, certain pathways in the brain are actually triggered in the same way as it is triggered when the brain is affected by substance abuse. So the development and the maintenance of a screen dependency disorder is increasingly seen as a maladaptive interaction between the neurological structures and functions which underlie the central components of addiction, as such the entire system. So if you look at this, the main pathway, again, there is a lot of debate here, but the main pathway is generally the mesolimbic pathway. So if you look at the mesolimbic pathway, it literally extends from the ventral tegmental area to the nucleus accumbens. So why is this pathway important? Because this is the pathway where there's a lot of secretion of dopamine. And dopamine is to do with reward, dopamine is to do with motivation. So what happens is it's so addictive that every time the child plays a video game, there is so much release of dopamine that happens that the child it's kind of reinforcing to the child to keep going back to get that same high that they're actually getting. Right? So what are the predisposing risk factors? So which class of children or young adolescents would you have to definitely worry about? Why is this important? Because for all of us who practice here, going forth, we have to start taking a history of use of screen time as a part of our screen examination, because a lot of the time this is going to cause many of the symptoms that actually the child presents with. So children on the whole are generally more susceptible to a dependency pattern. The age of initiation of giving a child a gadget in their hands and the level of exposure. So is it unsupervised? Is it supervised? Are parents monitoring what the child is watching? All of this plays a major role. Parental role model, which plays a huge role. Right? So you have couples at home, the father comes back from work, typically, no offense to the men, but typically, you sit back, you have a mobile phone, the TV is on, you're watching a match, by the time you're looking at messages, you're on a call. So what does the child see when he or she looks at the father or the mother? Is that this particular parent is always on the phone or the gadget. So it's why is it wrong for me to do the same? Right? So parental role model plays a very important role, and this again goes into a treatment plan as well. Children who come from dysfunctional families. So the internet is so wide it provides a route to escapism for children who come from families that have a lot of marital discord, a lot of abuse, a lot of physical trauma that's happening. So an easy way of getting away from all this would be to actually go online. Right? So supervision issues, like I said, both parents are working. There isn't time for them to supervise. There's no time for face-to-face interaction with the parents. So the easiest thing to do for the children would be to actually sit on the internet. If there is history of bullying or child abuse in a child, those children are more vulnerable. The personality characteristics of a particular child, somebody who's impulsive, somebody who's high novelty seeking, somebody who's low emotional stability, these kids are more prone towards going towards this direction, right? So what are the social, cognitive, emotional changes that happen because of this? Why are we worried about this and why are we talking about this? Because there's so much that's happening as a result of this. And like I said, children as young as 1 year, 2 years, even infancy period actually are exposed to tabs, right? So what happens in cognitive development? So the internet offers us ready-made solutions to all our problems, isn't it? So if right now you have child has an issue in school, they want to understand it's not given in the textbook. What does the child do? Googles, gets the answer. So the answer is tailor-made. It's there. It's ready-made. The child doesn't have to use his or her brains. They don't have to really struggle, and so it's there. So the natural inquisitiveness and a drive to discover is coming down as a result. The internet has amazing amount of storage capacity. So you don't have to actually remember. You read something, you say that you keep it there, you can always go back. So why are you forced to remember anything? So it discourages so much so that a kid to come back and say, I don't pay attention in class as much. Why? Because anyway they're uploading the notes on Teams, they're sending it on PowerPoints. So I can always go back and look at my notes, right? So it kind of discourages the child from paying attention. Reasoning capacities, excessive reliance on the internet leads to erroneous judgment. So a child feels if they read something on they're the master of the knowledge, isn't it? So you read your textbook. Earlier it was just textbooks. You go to the library, you pick up other books, you search, you make notes. So you go back saying, okay, I've learned something. But now it's you take a printout from the internet and the child knows everything. Oh, that's the feeling the child gets, right? So there's constant incoming stimuli, especially on the internet. So you find that that actually competes for attention. So as a result of which sustained attention or focus or concentration is coming down. So a lot of kids are now coming in with more ADHD, and there is a link, right? So attention deficit becomes a link. So if you look at cognitive development, we find that it's a very sequential learning. So you first learn the alphabets make sentences. So there's one particular way of learning. But in the internet, like I said, because everything is so ready-made, the child is not taught 1 to 2, 3, 4. They just go and they've already gotten the answer. So it hampers creativity, it hampers ingenuity, it creates low frustration tolerance. So there's immediate gratification that happens as a result of this. You look for something, you find the answer in the website, you learn on the website, or somebody's already found it for you. So that on the whole, there is no patience that the child is nowadays taught. Children are restless, children are impatient, they want ready-made answers. Right? So we have to understand that the brain cannot truly multitask, and this actually adds to it. Because what happens is this actually leads to a lack of focus, there's greater distractibility. So here we find that media multitasking leads to higher rates of ADHD or attention deficit hyperactivity disorder. People tend to lose sense of time, isn't it? Very engrossed in your phone or watching, I don't know, you're binge watching a series, you kind of lose track of time, you're not even sure what's happening. Kids watching cartoons for hours together, so they don't even know what time it is, what is to be done next. So basically, the instincts that were built in us, which were honed to face real life challenges, come down to a large extent because we hide ourselves behind the screen. If you look at the socio-emotional development, basically, as a child, what are you doing? You're attending and orienting yourself to a lot of social cues, isn't it? So the mother or the father smiles at the child. The child looks at the face of the mother or the father or the immediate caregiver. So there's so much that's happening there in terms of development, which goes because of the screen time. So emotional recognition, processing, what others think. So our non-verbal cues. So what is the other person thinking right now? What is the other person feeling right now? So all of this actually comes when we observe and we learn. But this is null and void practice when you do it online, because online it's all animated characters or you're doing a video call. It's very difficult to figure out exactly what the other person on the other side is thinking. So association between screen time and poor social communication has been seen. So it displaces attending to social cues in real life. So there are studies to show that the audio-visual networks are the ones that are stimulated and they compete with the social part of our brain. As a result, there are higher rates of autism and autism-related disorders which happen. Again, all of this is in the research case. In adolescents, what happens? Right? Like I said, understanding others' perspectives, empathy, which comes when you relate to somebody else, automatically goes down. The child is not able to gauge the emotional impact of something that he or she does. So let's say he or she leaves a comment on somebody else online. They don't know what the emotional impact is, isn't it? Because the other person is not immediately giving them a feedback. So this also leads, so you're not getting a feedback as a result of which your behavior is not modulated, you're not as empathetic. Written messages and emoticons do not in any way give us, so I can put up a smiley face, I may misunderstand the emoticon and send something else, I may mean something else. So there's a lot of miscommunication that happens. And there's a gap between one's action and the reaction that happens as a result. So let's say I send a message, I get a reply much later. So the time gap also creates a lot of anxiety. So how is all of this translating into psychiatric illnesses or morbidity which is happening? So like I said, poor feedback and lack of empathy leads to cyberbullying, right? Delayed communication leads to anxiety. So they put up a post, a photograph of themselves. There are no likes, there are no replies. There's nobody saying, "Oh, wow, you look fantastic." So that doesn't come. The child keeps checking, the Facebook post to see if somebody has written a like. So if there's no like, they're like, nobody likes what I'm doing. Stuff like that. So you're already feeling low. There's low self-esteem, right? There's anxiety. And on one hand, okay, so there's risk of exploitation. There's abuse that's happening online. So parents don't even know who the children are chatting with or what they're doing online. A lot of parents are coming in nowadays saying, "My child comes from school, goes and locks himself or herself up in his home. I don't know what the child is doing. When it's time to have dinner, I got the child outside, the child doesn't come." Right? Typical sort of history that you're hearing of nowadays, mainly because the parents have no idea who or what child is doing online. Right. So vulnerable adolescents are actually identifying themselves with sexually provocative virtual names. Stuff like this is not even known to the parents, right? Right. So this is on one hand, but on the other hand, what are the positivities that are happening? So if there are children who are actually utilizing the internet for the best, right? There's an opportunity for autonomy, exploration, if done properly. It enhances social skills, if done again properly. There's a good development of self-image and self-identity. Again, if all of this is done well, right? Motor development. Young children who are given tabs and mobile phones, the dexterity, the fine motor precision is lost because they're constantly swiping, isn't it? Unlike playing with blocks or unlike playing with toys. So all of this comes down and decrease in outdoor activity. So what happens? Child comes back from school, goes to tuitions, comes back. There is absolutely no outdoor activity. Child sits with the mobile phone or the TV. They eat and they sleep. So this causes increase in obesity, a lot of other physical problems, right? And sleep disturbance, irritability, dysphoria, name it. Moral development tendencies, children are very much at risk because they're vulnerable, they're people who are they're very curious, they're people who take a lot of risks, isn't it? So adolescents are enticed, they dive into the darker side of the web. So if you look at it, there's violence, there's addiction, there's problems with emotional skills, cognitive skills, there's cyber crimes. So I would be just dwelling into that quickly, right? So the good, the bad, the ugly of the internet. So the good, we all know, right? The good, it helps us, it's wonderful, it connects all of us. Hey, hooray, life is good. But the bad, what happens? So you have marathon watching of series. So all youngsters come and tell me, "I can't sleep in the night." Okay, what do? I binge watch Netflix. So I start with one episode, I really like it, and finish off the series. I'm up till 4 a.m. and then I can't sleep. The next day I have college, and so on and so forth. So there's marathon watching. There's online gambling, there's online gaming. This is again a problem. There's compulsive buying, right? There's porn addiction that's happening in very young kids. And sad to say, even in girl children who are addicted to porn and as a result, masturbation and so on and so forth. Cyber loafing. So you just you're loafing around, you go online, you check on your personal, they quickly go look at your tweets, quickly go look at your Facebook updates. So there's no focus on what you're doing, right? Technophorensic. So these are all new names that people have come up with, right? where there's interference and interruption of tech, which happens in relationships. Indigo children, truly talented children, but very socially maladjusted because they can't just bring their head up and look at the person sitting beside them. Cyber tsunami, interesting terms. Overload of information that comes to us like a tsunami, adding to the stress and anxiety. Drag along, you start with one task, you end up, I do that, you open one window, you sit there thinking, okay, I'm going to do this. Adukulla one pop up, or you suddenly remember, oh, in the email I've not replied. So you go there, then you finish that, then you're like, oh, I have to do this. So end of the day, you started with A, you would have finished or not finished something else, and A still remains, right? Escapism. And the ugly, so it gets quite ugly. So what cybercrime are we talking about? Phishing is when you're asked to give in your passwords, all your legal documents. That are cyber stalking that happens where you monitor one's activity, cyber dating abuse, cyber bullying, there's revenge porn, lots of stuff that's happening. And the ugly actually gets even uglier. How does that happen? There's digital self-harm that happens, right? So aggression, which is targeted to self digitally. So you put up fake messages, you put up photographs of yourself. I know of young girls who put up nude photos of themselves on Instagram to attract, I don't know, whatsoever. And then, there's this whole turmoil after that. Cyberchondria. So we have all our Google doctors who Google all their symptoms, come up with ready-made diagnosis, walk into your OPD, asking you to treat them particularly for that, right? You're not allowed to treat them for anything but this, but that. So you try telling them, no, this is not what I think you have, and that's it. They go to the next doctor, fine, you're not treating me for what I have. It's not what you know, it's what I know. So cyber sex, there is webcam child sex tourism, which is happening, where people pay to watch for webcam sex that is performed by 3-year-old children. So there is so much that's happening on the uglier side um, because of the internet. So just a note on gaming disorder, I'm not going to go into the details. So in case you need to ask some of your young adolescents about which games they're on, you may gain more rapport if you already know the names of the games. If they tell you I'm playing this, and then you look at them aghast, then the rapport is done there and there, right? So Battlefield is one, Call of Duty, Counter Strike. So like I started off Mr. J, isn't it? So you have young boys and girls coming with gaming addiction that's happening, right? You have apps for toddlers, right? There are apps which are put up on your right hands for children to help with potty training. So as the child passes motion, they can watch something to entertain them. So it's become that easy, right? Then of course you have entertainment apps, you have educational apps, you name it. Schooling can be done at home, literally, right? You have dating apps for our young adolescents again and young adults, right? So you have everything from top to bottom. So I know Tinder's on the top. I have a lot of clients who are on Tinder. And why it has its repercussions. It's dating apps are, I don't want to comment. Right. So what are some of the questions that generally tend to run through our mind as practitioners? What are the guidelines for screen time? Because this is one question parents come and ask me, right? So mobile phone, what do you tell them? How do I help the child who has an issue as such? When do I refer? So I'm a general practitioner. So what do I do? When do I refer to a specialist? Do we have to admit the child is that bad, or do I just treat the child as an outpatient? Does the family help, or are we only treating the child? So if I say உன்னோட ஸ்பைன் சரியால இனிமேல் டிவி பார்க்காது அப்படின்னு சொன்னா is any child willing to listen? Right from 3-year-olds, no one is willing to listen. So when I ask them to stop, do they stop? No. So then the next easy question is, do you have medications for this? Is there like a magic pill that I give and then this whole thing just, and my child is back, to being children as such? So are there any medications? Do medications help? And how do I diagnose a screen dependency disorder in young children? Say adolescents, where you talk, you get history out of them, you kind of figure out that this is what they're up to. Very young children, it's very difficult, isn't it? So to answer some of your questions, according to recommendations, 2 years and younger, no screen time at all, right? 2 to 4 years, not more than an hour per day. None of this is followed by me, but this is just guidance. 5 years and more, not more than 2 hours per day. If you look at the pandemic, children's school activities itself went on from 8 till 3. What are we talking about? Children with, I think, if I'm not mistaken, they had some 5-minute break and 2-minute break and some lunch break for half an hour and back to the screen. So none of this was followed, but yet it's good to know. Right? Right. So as practitioners, I think the first thing is to use our clinical judgment. We're all practitioners, we all have a clinical judgment. So it's not about whether we're going to diagnose and put a set of criteria and label them as somebody who has a problem. It's also about figuring out how much of this is affecting general life, how much of this is affecting their functionality, what is it that we're going to intervene, where are we going to intervene, and how much are we going to help them as such, right? So it may be most practical to consider the issue of dependency on a continuum, so and not have strict criteria and say 4 out of 5 yes, 3 out of 4 no. It doesn't work that way, right? So general criteria, like I told you, preoccupation, withdrawal, this is for the very dependent ones, tolerance, failure to reduce, loss of outside interest. Either classic as it comes, all of us will know. Maybe on an outpatient basis, questionnaires can help. So in case you kind of feel okay, maybe this child has an issue, maybe just quick questionnaire can actually help. So there's one that's very commonly popular is the internet addiction test. Right? So you have criteria, so you can look at it and then kind of figure out where the child stands. So in younger children, if you have symptoms of, again, most common symptoms that parents bring the children for is lack of attention and focus. School focus பண்ண மாட்டேங்கிறான், படிக்க மாட்டேங்கிறான், வீட்டுல ஏதாச்சும் தூக்கி போடுறான், சொல்ல பேச்சு கேட்க மாட்டேங்கிறான், homework எழுத மாட்டேங்கிறான். These are the most common, symptoms with which parents bring children. A lot of anger. Kids, if they get angry, they will throw. First thing they get is a mobile phone. They have the mobile phone to throw. Madam, ரெண்டு mobile phone ஒடிச்சிட்டாரு, 3 mobile phone ஒடிச்சிட்டாரு. Why you give them another one? God only knows. Anyway, tantrums, right? Avoid social interaction. யாராவது வீட்டுக்கு வந்தா தலை நிமிர்ந்து கூட they will not see. They will not even come out of the room. Forget talking to the other person. They won't even come out of the room. Right? Speech delays are happening. Milestone delays are happening in young children. Sleep problems. தூங்கவே மாட்டேங்கிறாங்க, நைட் ஃபுல்லா முடிச்சிருக்காங்க. So these are some of the warning signs. So again, like I said, you need to take a history to ascertain whether this is because of what we are talking about. Yes, definitely refer when you feel it's required, when you feel a specialist needs to take over. Prevention should be the focus of intervention, right? So it's about, educating all our patients who walk in, telling them that this isn't, everybody knows it's not good, right? But unless I think we sit with families and explain the level of where this is at, I don't think people are actually going to make a difference. Like I said, consider taking a media history going forth, right? Anticipatory guidance to families. Ask them to limit their usage first. Parents are your first role models, isn't it? Parents have to follow the same thing. There's no hygiene in the parents, the children are not going to follow. Right? So our goal of management is not complete abstinence. Our goal of management is actually to have a very balanced usage. So if there are particular apps or areas where you find the child is misusing internet, maybe stay away from that. But the child is still allowed to use the internet, but with supervision, right? Treat comorbid psychiatric issues if there are any. So I'm talking about ADHD, anxiety, depression, whatnot, suicidalitis, etc. Improve coping skills, treat substance dependence if there's any. Enhance the social support. Address craving. So if they are slightly older children, you can actually talk to them about whether they crave, and if so, how do you combat that? Set up internet use barriers. So you have these apps, right? So even for example, Netflix and all of that. I think there are, I'm not sure if it's Netflix, but there are. Yeah. So you have passwords, or you have this time for so much time is where you can watch and then it switches off, right? So you have internet barriers that you can actually use. You have external stoppers. And you tell the child 5 minutes, 10 minutes, then you kind of bring the child, let them do something and stuff like that, right? Use reminders, so you can probably put up charts or something and say why internet is bad when done in large quantities, why is it good, etc. Right? So family therapy. Remind the child how nice it is for the child to actually go out and play with friends, actually go and play hide and seek, actually go and play peekaboo, etc. Right? So role of pharmacotherapy is such, there aren't any great validated studies, but yes, there are certain medications that we can use. But I think it also aims at treating the psychiatric comorbidities that come along with it. So pharmacy examples, designate bedroom, screen-free rooms. So for example, we routinely tell all our parents, at least an hour before bed, please switch off all your gadgets. That goes for the kids as well. I know a lot of children who watch TV or iPad till 10 o'clock and then they're asked to go to bed at 10:05. Right? That doesn't work. So at least switch off an hour before. Use screens sparingly for children under 2. Choose age-appropriate shows, right? So you need to be aware that, YouTube, etc. They have like a kid-friendly version that you can probably use. The main YouTube has a lot of pop-ups and ads that you don't want your children to watch, right? Stay involved, try and sit, co-watch with them to see what they're watching, so that you monitor, you have like an idea of what the child is up to. In conclusion, technology is here to stay, right? And whatever effects or repercussions of the pandemic is also long lasting and is here to stay again. So we have to realize that there are several concerns. We have to rise to the new occasion, which is the new normal, right? So our goal again is prevention, our goal is healthy usage and not dependency, right? So the continued reliance on technology amongst children and adolescents kind of compels us to strike now the new term is screen life balance. So you have a life, you have a screen life. So basically, you're trying to have a balance there. So each action, whether it's a parent, doctor, teacher, policymakers, it needs to be based on the understanding that there's a very complex interaction between all three. Thank you so much. Thank you for patient listening.